Hi, everyone. I'm Avery Irons, the Associate for Technical Assistant at the New York State Youth Justice Institute. Thank you for joining us for Day 3 of Are the Kids All Right?, our COVID-19 and Youth Forum. This morning, we bring to you a panel focused on educational environments titled COVID-19 in Education, Equity and Access to Learning and Vital Supports. We want to thank our excellent panel of scholars, advocates, and practitioners who are here with us today. But before we introduce them, I want to offer a few key themes from our panels on Tuesday and Wednesday so that we can connect those conversations to our conversation today. I also invite you to view those discussions on the YJI's Facebook page. So we started off the week on Tuesday with our homes panel in the morning, and a few of the thoughts that really resonated with the panelists and also the attendees were that children are not resilient. They are absorbent and need community support to thrive. The current drastic cuts in services means that youth and families who were already at risk, especially those who cannot access internet-based services, are now even more at risk. That afternoon, our communities panel really talked us through healing. We can center healing by addressing systemic conditions that led to someone's trauma, making sure that institutions like schools practice healing work by financially investing in healing responses, and expanding our definition of data to include the stories of lived experiences and other non-qualitative or non-quantitative sources of information. For Day 2, that was our Justice Systems Day, in which we had a Justice Systems panel in the morning and also in the afternoon. Our Justice Systems Panel 1 brought to us this notion that the pandemic is a racial and economic crisis that illustrates the impact of segregation, unemployment, lack of healthy food access, and other inequities that communities of color suffer. All of these things are also connected to the justice system. Healing is not linear or perfect. Workers and agencies should try to track and understand what is happening to the people who they serve, remove judgment, seek creative community partnerships, and adopt a family-centered approach to understand their needs. And finally, in the afternoon, we had our second Justice Systems panel, which really told us that we should put our values first, meet people where they are, and have their needs guide our research. The money exists for a strong network of reentry and support services for youth. We should identify and fund community-based services that benefit kids and move services from detention centers to communities. We can create something better. So thank you so much for allowing me to bring those conversations into this conversation. Hopefully we can integrate them in what we speak about today. And also we will be further reviewing our conversations tomorrow during our cross-panel conversation scheduled from 10 to 11:30. We also want to briefly cover a couple of housekeeping matters. I will just start this off by saying if you have any technical issues during the course of this webinar, we ask that you email the Youth Justice Institute directly at youthjustice@albany.edu. That link should be showing up in the chat just about now. And with that, I will turn the housekeeping matters further over to my colleague, Alicia.
Hello, my name is Alicia Gagnon, and I'm a research assistant at the Youth Justice Institute. Thank you again for joining us today. As our presenters today are speaking, you're welcome to ask questions in the Q&A section or in the Facebook comments as we go along. We will have some time at the end of this session for these questions, but in case we don't get to all of them, we are keeping track and we'll do our best after the conclusion of the forum to answer the remaining questions. At a various point in this presentation, a poll question may appear on your screen if you're joining us on Zoom. Simply select your choice and anonymized results will be tallied and presented in real time. We have Angelique McAlpine of Drawing Impact providing live digital visual note-taking. Her screen will be projecting alongside the panelists' videos. You can adjust the relative size of the panelists' videos and Angelique's drawings by shifting the vertical sliding bar to the left or to the right to suit your preference. Please feel free to try that right now with the slides and my video that are showing. This session and all of our sessions are being recorded and will be available to watch at a later point. And now I'll pass it on to Samaria.
Hi everyone, my name is Samaria and I'm a Youth Justice Institute scholar. We would like to invite you to engage with your fellow attendees throughout the week and afterwards on our online Padlet board, which we'll link in the chat. This is a virtual bulletin board intended to serve as a collaboration and networking space similar to at a professional in-person conference. On Padlet, as well as in the Zoom chat, Please remember to be constructive and kind as we move through this conversation together. And now I'd like to introduce Dr. Giza Lopez, Executive Director of the New York State Youth Justice Institute, to present some opening remarks as we begin this session.
Good morning, everyone, and thank you very much, Samaria, for this kind introduction, and to Avery and Alicia for helping kick off this event today. If you're new to the event, welcome. If you've joined us in the past discussions throughout the week, welcome back to our forum. My name is Giza Lopez, and I am the Executive Director of the New York State Youth Justice Institute. We have a very diverse audience here today. Many of you come from local and state governments all over the country, as well as universities and schools, nonprofits, and research centers from near and far. Thank you very much for joining us today and for your endurance in coping with yet another Zoom event. This forum is designed to bring together insights from multiple disciplines and from diverse professional fields to discuss three very big questions. One, what are the current impacts of the pandemic on youth? Two, what are the foreseeable long-term impacts of this crisis on this population? And three, what practice and policy innovations have emerged out of this situation that might lend themselves to sustainable efforts moving forward? Our approach to these questions is overlaid by an equity lens. Throughout our discussions, we've sought to focus on the pandemic's disparate impacts on historically marginalized populations, including youth of color, youth with behavioral health needs, LGBTQI youth, youth with disabilities, and immigrant youth. Since Tuesday, as Avery aptly summarized for us, we've benefited from the insight of phenomenal experts as they guided us through answering these questions in three vital environments: homes, communities, and justice systems. This morning, we shift to educational settings. Just in the past few months, an entire generation of children have had their education upended. According to the UNESCO, as of May 24th of this year, over 1.7 billion learners were affected by school closures worldwide. This means, among other things, lack of access to crucial services, to food and health checks, not to mention the unequivocal impact on learning. For teens, at a minimum, this has resulted in a lack of daily physical contact with peers, a critical source of support at that developmental stage. The 2020 high school cohort of graduates may choose to delay college education to support unemployed parents. Some may never return to their original plans. For young adults who are graduating from college now, the prospects of getting a job are less than certain. And for justice-involved youth, this crisis has compromised even further their ability to receive quality education in custodial settings. I want to take a moment and have a shout out here for parents, for students, for teachers, for educators everywhere, for staff in schools and universities who had to pivot overnight to an online environment and wear multiple hats with very little notice. We at the YJI are located in a university setting at the University at Albany, part of the SUNY system, and we felt the impact of the pandemic in our professional setting very directly. And my shout out goes to those of us who had to adapt very nimbly to the situation, and especially to the students who went along and showed a lot of grit and flexibility along the way. We are absolutely honored to have a stellar roster of experts continue to lead our discussions today and tomorrow, and to help us get closer to answers that will guide our collective work moving forward. My many, many, many thanks to the panelists, to the moderators, and to our plenary and keynote speakers, Michael and Pierre and Professor John Powell. If you haven't signed up for tomorrow's sessions, I encourage you to do so. My thanks also to the staff and the scholars of the YJI, and especially Alicia Gagnon, Avery Irons, and Brian Rainey. Behind the scenes, we have an army of incredible college students making sure everything is running smoothly. Samaria Alpern, whom you've met, Sasha Baroda, Paul White, Justine Dicio, and Jiwon Ryu. None of this could have happened without their hard work, so thanks to them. The YJI results from a partnership between the New York State Division of Criminal Justice Services, the New York State Office of Children and Family Services, and as I mentioned, the University at Albany. My many thanks to the YJI's Executive Board and to the New York State Juvenile Justice Advisory Group for their incredible and unwavering support for the Institute. My thanks also to SUNY distinguished professors and former deans of the School of Criminal Justice, Bill Pridemore and Alan Lizotte, to Professor Megan Kurlichek at Penn State, to the staff of the Division for Research at SUNY, and to Diane Sierpino from the Tau Foundation for all their help. Let's get started by introducing our stellar panelists and moderator for today. Joining us today, we have KELLI CASEMAN, who is the co-founder and executive director of Think Kids. KELLI has over 15 years of experience working in the fields of children's health and education, including as executive director of the West Virginia School-Based Health Assembly. She is a member of the Robert Wood Johnson Foundation's Interdisciplinary Research Leaders Program, studying the linkages between healthcare and public education in rural West Virginia, with researchers at Child Trends and Penn State University. Welcome, KELLI. Also with us today is Christy Crawford. Christy serves as Director of Culturally Responsive Sustaining Education for New York City's Computer Science for All initiative. For more than a decade, she taught K-8 classes in Harlem and Bronx. She was also a curriculum fellow for the New York City Computer Science for All Blueprint and an adjunct lecturer for the City College of New York. She was an education consultant for companies such as Scholastic, BrainPop, and Nickelodeon. Prior to teaching, Crawford was a television producer for several networks. She uses her experience in education and media to foster equity by all means necessary. Welcome, Christy. Also with us today is LYNETTE TANNIS. LYNETTE began her education career more than 2 decades ago and has served in a myriad of educational roles, including teacher, athletic coach, literacy coordinator, school and district administrator, professional developer, researcher, lecturer, education consultant, and education delegate throughout the United States and within 5 continents: Africa, Asia, Europe, North America, and South America. She is the author of an incredible book, Educating Incarcerated Youth, exploring the impact of relationships, expectations, resources, and accountability. LYNETTE is widely recognized as a juvenile justice education expert and an expert on school leadership and literacy. And to moderate all of this expertise, we have with us Dr. Eddie Fergus. Eddie is an applied researcher at Temple University. His work explores the effects of educational policy and practice as it intersects the lives of populations living in vulnerable conditions. More specifically, his policy work extrapolates the relationship between discipline codes of conduct, gifted program practice, and academic referral processes and the educational outcomes for low-income and racial, ethnic, minority student populations. This work also outlines policy and practice changes in order for schools to develop as protective environments for vulnerable populations. Wow, I can't wait to see this, the discussion that will unfold. Thank you very much to all of you for being here. Thanks again to the audience. And Eddie, take it away, please.
All right, good morning, everyone. Thank you for joining us. It's exciting to not only sort of participate in the Youth Justice Institute's conference, virtual conference, I should say, but also the opportunity for us to engage in a myriad of conversations related to not only sort of the current sort of conditions that are happening, but also under the umbrella of recognizing particular populations that we're concerned about, which are youth that are justice involved on sort of various levels. As somebody who is a professor at Temple University whose work focuses on the patterns in which school systems systematically maintain patterns of disparity, particularly around discipline, have always been concerned around the intersection of, as a colleague of mine said to me years ago, that it's unless we get it together in the school system, how our youth show up in the justice system may not necessarily have a developmental approach to it, may not necessarily have a prevention or intervening sort of lens to it. And so I've always been sort of mindful within my own work is, how do we make sure we sort of ensure that our systems are intersecting in very appropriate ways, that we are still creating greater opportunities for our kids. So one of the things I want to sort of establish as we kind of jump in as a panel is to set a tone for sort of the conversations that we're going to have today in the context in which we're currently living, right? I would be remiss if I didn't sort of acknowledge that, we're having in ed policy, there's this theory called punctuated equilibrium. The idea that policy tends to have sort of this flat line of sort of just doing its usual thing. And then there's a punctuated moment, meaning an event that kind of really sort of changes the manner in which we sort of think about things. And we're in a moment right now that obviously COVID-19 has really punctuated the ways in which we've been approaching the idea of teaching and learning, the manner in which we are understanding how do we provide social supports for our children within and outside of schools. And I think sort of this panel is providing us an opportunity to really sort of engage in that. But the other component that I think is also being punctuated here, but I have to acknowledge that it's a punctuation that continues to happen. But the question is always left is, what's the degree to which we're actually going to make major shifts in our educational terrain? And it's really around sort of the nature to which we are yet again in a moment in terms of seeing the systematic nature of what it means to be dehumanized, particularly among communities of color and specifically Black community within the context of the US. And so I'm excited about sort of having this diverse panel of folks to be able to talk about sort of this punctuation that's happening, not only in terms of COVID-19 that we anticipate will have some level of a vaccine or cure that emerges at some point, but also the punctuation that's happening in terms of the nature in which we yet again, we're seeing the systematic nature of oppression, which we yet have figured out what is the vaccine for that. And I like to sort of imagine that the school systems, the way in which we educate, could and has the potential of being that vaccine. But the question becomes, how are we thinking about this as we move forward? So I'm excited about this panel sort of lending in their great, ideas and sort of helping not only sort of feed the community that of you all who are out there participating, but also for you all as a broader community to also feed each other. So we look forward to not only the set of questions we're going to pose to our panelists who are going to, who've done some great prep work to get us going, but also what we anticipate is getting into a really juicy and exciting Q&A section of our time together. So I'm going to go ahead and get started by sort of providing, just giving each panelist an opportunity to provide sort of a brief overview of, from their vantage point, what they understood as sort of a pre-COVID-19 state of your work and the populations that you were serving. And as well as sort of now that we're several months in to having within the confines of education really removed what we in our educational policy sort of work is, we've taken away some of these accountability pieces to just let learning happen. And we'd love to hear from each panelist, sort of what's your overview of sort of what was looking like before and what you're seeing sort of things are existing now. All right. So I think we're going to start with, LYNETTE.
All right. Thank you, Eddie. Good morning. So for me, in terms of this incarcerated youth space, sort of pre-COVID, I think it's important that everyone knows there's more than 1.1 million cases that are heard each year. That's based on the National Juvenile Court statistics in our juvenile courts. And that equates, and fortunately the numbers have significantly decreased over time because of work by the Annie Casey Foundation and others. But that equates to about 130,000 youth incarcerated each year, which is approximately 55,000 youth on any given day. We have about 1,500 juvenile facilities nationwide, and 55% of those are publicly owned and 45% privately owned, for-profit and not-for-profit. And so just in terms of the pre-COVID-19, those are definitely the stats. There was a study that was done in 2011 by Reed and O'Cummings, which showed that only 65% of incarcerated youth were receiving an educational program in all, based on the facilities. Only 65% of the facilities were actually providing that for youth. And so now when we look at what we're experiencing with COVID, the good thing is because of a lot of advocacy work, also recognizing that almost 70% of youth who are incarcerated are for nonviolent offenses. The numbers of youth some youth have been allowed to be removed from the facilities, which is awesome. And then the other piece to that is, of course, that still exists, and the disparities, of course, continue because with some of the youth having the virus, and then even some staff, for their protection, once again, they end up being in isolation. And so in some of the places for education, the educators are no longer there in those facilities. And so it is the in-house staff, the youth care workers, juvenile justice specialists, that kind of thing, who are then sort of providing this education for the youth.
Wow. Those are staggering numbers, but also recognizing the importance of sort of where we can have effect. Thank you, Lynette, for sort of setting that sort of terrain for us. I'd love to hear from KELLI next in terms of, again, pre-COVID, the realities of, in the space that you're existing in terms of that intersection around health, rural populations, and in particular sort of school-based health centers type of work. What are some of the dynamics that you saw pre-COVID and then now several months in?
That's a hefty order. So I am KELLI CASEMAN. I'm the co-founder and executive director of Think Kids. And we are a newly formed 501c3 in the state of West Virginia, and we focus on data-driven advocacy to improve policy from the state to the community levels. I'm also a fellow with Robert Wood Johnson Interdisciplinary Research Leadership Program, and we have a research project called Improving Health Among Youth in Rural Appalachia, Enhancing School-Based Health Centers. And so we really look at the way policy interacts between public health, public education, and to a certain extent, the child welfare system. And so pre-COVID, we were looking at projects such as how do you better link the healthcare system with community food access points. So if a child's in a doctor's office and is identified as food insecure, how do you ensure that child gets from point A to point B in a really warm handoff, meaningful way, rather than just get a slip of paper with a phone number and a name. So that was pre-COVID. Now post-COVID, it's very different, and yet it's almost the same, because what we're seeing, as you mentioned, Eddie, is kind of a shining light on bad policy that is really concerning, that kids who are marginalized may fall further down the cracks and fall off radars. So we're really trying to look at, since, I wouldn't call it a good thing, but something that is an opportunity right now is we find that really rigid policies are suddenly not as rigid as one had first thought. And so it's a really good time to utilize the opportunities to make good policy reform and to keep things that are working in the pandemic moving forward. Mm-hmm.
Thank you for sharing, KELLI. And I appreciate your point around what we imagined was a very static policy that we just can't budge, and all of a sudden it's not so rigid, right? That there's a level of flexibility. Christy, also, again, as in the space that you're existing in around computer science for all as one of those big hallmark initiatives, sort of the pre-COVID, and now sort of as we move into sort of this, having been in sort of this moment for quite a while now, and particularly in the school systems, what are you seeing and understanding as some of the dynamics that are emerging for providing the level of equity that's intended around computer science for all?
So we need to ensure that everyone K through 12 learns computer science in school after graduation. And the purpose of CS for All is to reach everybody so that every child has an opportunity to use computer science for coping or creativity or social justice. But now the problem is so obvious to all of us. Computer science was put on the back burner. How do teachers have enough time in the school day when you were just trying to teach somebody to read, and now we're asking you to teach somebody to program? But the most difficult part is realizing that high-speed internet access or having equipment is a basic right. You're realizing that folks can't communicate. They can't be part of this new civil rights movement because they simply don't have the materials they need, materials that should really be as basic as food and water. So we've gone through the challenges of how do we get equipment into the hands of all of these children, and then rapid fire training on new resources and planning for remote lessons. So our teachers are amazing. These teachers think of themselves as artists. They are artists, but we haven't given folks the time or learners the time to modify the medium to where it should be.
Mm-hmm. And, to stay on that point, I mean, you're highlighting, you're right, this rapid movement from what I call sort of our brick and mortar approach to teaching to an online virtual sort of space of teaching and learning has come at such a rapid pace, and is really highlighted, as you said, the not only sort of the absence of importance around computer science, but also just the technical pieces of having it. From your vantage point, and in terms of the ways in which the school systems and its intersection with families are online, what do you see are some of the set of equity and access issues that need to be considered as we think about, summer is coming up, right? So it's the question around, how are we sort of providing sort of the levels of access and opportunity that are necessary for populations that we're serving that are needing sort of these levels of access as we think about the summer, but also, as you're thinking about sort of that digital literacy moving into the fall?
There are two big pieces for us. Any company, before they go into a new territory, would provide a full market analysis. And educators we didn't have that opportunity. That full market analysis needs to be happening now in every single state. Who actually has the equipment in a household? Who are you sharing the equipment with in this household? Are you just a cell phone home? So how many hours a day are you spending on that equipment? Is your grown-up, is your parent an essential worker? Are they able to assist you with that equipment? Are they able to assist you in lessons? Are they comfortable in doing so? Where can the parent get training? The number of questions that have to be asked so that we can provide appropriate supports are just mind-boggling. It is really the time to listen to families. Families are the folks that are in the house and that can give you a real-time understanding of what's happening. So if ever we were going to talk about families having equal partnership with the school building, it's now. And I think the second piece that is incredibly difficult is allowing us all to be really cognizant of what happens when stress is on the brain. We are absolutely in love with Zaretta Hammond. So Zaretta Hammond, of course, has written a book about what happens when stress is on the brain. So now these kids have a double trauma. It's pandemic stress and there's racial stress. our staff actually started working with the developmental psychologists to figure out how do we ease stress on the brain so that we can actually provide time for children to relax, to have a safe environment and begin learning. And with many STEM subjects, kids feel some sort of imposter threat. Do I belong here? Am I part of this work? But we can't even get to computer science work, to computational work, until we can get folks comfortable. And what's been happening? There's this invisible monster of COVID. There are riots, there are fires, and we are seeing the murder of George Floyd being played out again and again. And at the same time, kids are being asked to share devices with another sibling. They have apps who are crashing. You're out of your normal routine. As an adult, I don't know how to stay on task, and I don't understand how we can possibly ask children to do so in this moment.
Mm-hmm. Thank you so much. And you're right, that full market analysis is necessary, and the nature to which developmentally this, how we are reorganizing our work so that we meet the social, emotional, and mental health needs of our kids. And in some ways, sort of that, it makes me sort of wonder, Kelly, from your vantage point, the similar vein in terms of as we are understanding the nature to which there's going to be some form of hybrid learning, for not only just for next year, but potentially for the year moving forward. I know we just got announcement at Temple as faculty that, to plan for hybrid learning. The campus will be open, but there will be hybrid learning. There'll be a mix of in classroom and virtual. And so as we think about the possibilities of school buildings being closed at various moments, right, over the next year or two, from your vantage point, from a health equity perspective, what should stakeholders consider when planning services in these types of uncertain environments?
So there are a number of things that we need to consider. I'm going to talk about 4. First, we need to consider that there's already a lot of shared space between healthcare and schools. So, in more important ways than we realize. So, for a number of kids, before they start school, they have to get their vaccinations, right? They have to get maybe an oral health check. They have to get their well child exam. And for some kids, that may be the only time that they're accessing healthcare. It may be those sports physicals that they get annually, but that's somebody from the healthcare system, able to meaningfully screen them, have eyes on them, and build that relationship between the child and the healthcare system. So there is concern that once we start this hybrid learning, shall we say, and the schools aren't open in the same ways, and we disrupt these patterns, these well-worn paths that these communities have, and how these kids access healthcare. So, for example, if it's vaccinations before school starts, you'll have, in some states, pharmacies have, clinics. Hospitals may have clinics. You disrupt all of that, then people aren't really sure how they access the healthcare system. Who do I talk to? They may not have primary care providers. And so that connection really needs to stay in place regardless of when the school is open. There's not a lot of data out there right now because, COVID-19 is new. So it's hard for us to look at past experiences to change policy for now, but we do know, and this was reported a few weeks ago from the CDC, that researchers looked at vaccine ordering data from pediatricians in the Vaccine for Children's program, which provides vaccinations for half the kids in the US, and what they found was childhood vaccination efforts had virtually come to a stop between mid-March and mid-April. And so that is a real concern, that when the schools shut down, the healthcare facilities may very well just shut down too. And kids aren't going to have access to services that they need to have that are face-to-face, not via telehealth. And so that's something that we have to keep in mind when the schools close, that the healthcare facilities are closing. We need to remember that not all communities access healthcare in the same way. So for an example, in my state, when we first went on shutdown, the message was, everyone, if you have symptoms, call your primary care provider. We know a number of people, especially in marginalized communities, don't have primary care providers. They're apprehensive to access the healthcare system, because of something like surprise billing, and they're not sure how much it's going to cost them. And then B, it's because they don't have a lot of trust in the healthcare system. And we know that there are racial disparities, well documented in the healthcare system as it is. And so I hope to talk about this a little more later, we need to make sure that the channels of communication for these communities of color, children with disabilities, are at the table when schools are planning on reopening, to ensure that how they access healthcare is discussed. So no kids are really left behind when they start working on building those bridges between the systems. Number 3, knowing that it will probably be stop and go when kids can't physically attend school. You need to be mindful of what services kids need access to while we're not in a lockdown. So we, as Christy had mentioned earlier, kids are going to need more access to comprehensive mental health care, right? So now is the time to really have those conversations about what community services you have. Are the community services pediatric focused? Do the providers take children with Medicaid? What is the wait time? It's a lot of really important questions that are conversations that should be happening now.
Mm-hmm.
And then lastly, we really need to have an honest conversation about the environment we're living in. And Christy mentioned that earlier. So, kids are stuck at home right now with more hours, of screen time. They're seeing a lot of things on social media that could be very threatening and scary. And communities really need to talk about meaningful access to services. So it's really a community assessment as to what services are provided, what services, health services the schools provide, and the continuum of care. So if the school can't provide it, can the community provide it?
That's a litany of things that it's going to be super important that, as was mentioned earlier, it's like, the nature to which not only sort of policies needing to be less rigid, but also the manner in which we imagine practice being less rigid. And in some ways, reimagining sort of the strategies that we're going to need to take on. Sort of, it's a nimbleness that we've never sort of had an opportunity to practice, but we sure as heck have an opportunity to do it now, right?
And it's a wonderful opportunity, because we know that the healthcare system is hurting right now because they're not seeing as many patients as they should.
Yeah.
And so if we build those strong collaborations, the healthcare system will get the patients that they need, right? So it's a real opportune time, but everyone needs to be talking right now.
Right. It's reminding me of many years ago, about 20 years ago, I used to be a community school director, and sort of valued immensely sort of having the range of partnerships in being housed within a school and providing after school and before school, and having dental chair and the mental health suite, and providing programming from 7 a.m. till 11 o'clock at night, 6 days a week. But that required a large level of nimbleness amongst everybody and reimagining sort of what their practice meant. That's amazing. Lynette, so we've been talking about sort of the nature of, what's, the health side of sort of what we're providing children and their families, the nature of particular sort of aspects of instruction that's being made available or not in our various environments. When we're talking and thinking about sort of our youth, who are our justice involved youth, right? We're less aware about sort of the shifts that are happening in terms of detention and placement settings, and also the settings for those that are sort of among emerging adults, right? So those older teens. Can you sort of share with us sort of like what have been some of those major sort of sets of shifts and challenges that are currently happening, but also how do you see sort of the opportunities within the system moving forward?
Sure. So I would first say, a huge challenge even before COVID in this space is, how do you provide high quality instruction when there could be ages, say 8 years old through 17 or 18, depending on the state statute in terms of age when they would just automatically go to an adult facility. How do you provide math instruction when you are teaching elementary math, middle school, algebra, geometry, right? And so there's still so much a need around that. But particularly what has happened and what is happening is, it's also just been very interesting to see how some states, for the most part, and I guess it also depends on who the educational provider is for the spaces. So I will just also share, in across the 50 states, about 16 of them, it is the juvenile justice agency that is responsible for the education. Now they may subcontract that out, but just so you have an idea, it's like the Department of Juvenile Justice or something like that. In another 16 states, it is the sort of state Department of Education that's responsible. So then that would then go to like the local school districts or county districts that are then responsible. And then there's a handful where it's like the Health and Human Services. So, and then some just have their own district. So there's so much variability within that. So, but I just wanted to at least put that out there for everyone to understand. So when, states made the determination and then local school districts determined that we will no longer physically go to school, that we would have this sort of online platform, it was kind of like, well, what are we going to do with our juvenile justice schools, right? And I would say the decisions that were made were kind of based on the different structures and who's responsible for education. And so in some of the states, even when across the United States, for the most part, especially in those states where it was hit very hard, who no one from the education community was going into their schools, they actually still were having those teachers go into the facilities every day, right? And so there's, of course, the debate on, okay, is now the time you choose to value education, right? Their lives do matter, yes, right? But then it's kind of like, but I thought we're supposed to be like in isolation, and so there's sort of that piece. In others, they tried some attempt to do some kind of online or remote learning, but I think it's also just really important that people understand, there still is this lack of technology. And again, similar to what Christy mentioned, our facilities, the staff, for the most part, they are the in loco parentis, right? They are there in place of the parent. And if there is already pre-COVID, not the right technological structures, or even just the belief that we need to expose children to these rich learning tools, these are life tools, right? Then what happens now in this true crisis? And so what ended up happening in other states is it ended up being the, juvenile justice staff or corrections officers, depending on youth care workers, depending on where you are and what they're called, who then the teachers may have provided like packets of work. In some places where they do have a computer lab, then some of the youth were able to go down for like credit recovery and sort of other things. But what ended up happening in many places, because the youth ended up testing positive for coronavirus, is this sort of true isolation. And then to sort of help keep everyone safe, we need to limit their movement. And so that also meant that there were a complete restriction on like family visitations and other things. So that's kind of what has been happening. But the good news is that in some places, the teachers, because they are working remotely and not necessarily talking and connecting with the youth, they've kind of looking at their educational program and seeing how could we be doing this different when we return. And so like one state reached out to me, they had never implemented project-based learning before, but just wanted just additional resources and support around that so that when they do re-enter, they can at least try to provide a sort of higher quality, a richer level of experience for their youth.
That's amazing. And that's great that there's, again, that nimbleness is showing up amongst practitioners in that space and at least asking for help, right? Instead of trying to sort of sustain that which they were doing beforehand, recognize it's not going to be the right fit given the context in which we're in. So bridging sort of from Lynette's last point around this idea of sort of how do we reimagine sort of this, the curricular sort of space, meaning particularly the opportunity of us doing learning in a different way. You know, I want to ask Christy regarding, you know, the ways in which we approach and think about the idea of pedagogy and sort of motivational supports, particularly for sort of our various, our kiddos who were struggling before, right? One of the things that, you know, that the work in terms of that I do is, and particularly now and with practitioners, is around, you know, how do we make sure that this interrupted education that started in March doesn't lead to an early onset of a summer learning loss, because there's been that sort of massive interruption, and not only sort of the instructional rhythm, but also the learning rhythm that comes alongside of it. But most importantly, what this virtual learning has also sort of done is it's forced this idea or this behavior of independent learning that may not necessarily have been at play for all kiddos, right? And so how are we thinking about, how are you all sort of particularly in the wheelhouse of work that you're doing at DOE, New York City DOE, is thinking about the maintenance of engagement and kids being on track, particularly your kiddos who were academically, they were behind beforehand, as you start sort of thinking about the reopening in the fall, right? Like, what does school need to look like in such a way that it is managing those set of conditions of interrupted learning that transpired from March to June?
There are just so many pieces, but to begin with, we go back to that family piece, because even though folks are using lots of apps and different programs to check for understanding, you know, somebody's parent who is home who can tell you much more of what's happening. Unfortunately, there's so much screen time. There are many educators who just haven't had chance to become the artists that they were in the classroom. So the lesson may just be on the screen, and it may not be a synchronous lesson that is appropriate for certain children. It may in fact be quite passive. But what I see is some genius educators who are able to talk to the parents. Is your kid on TikTok? Is your kid on Snapchat? And believe it or not, that's the way that some lessons are being delivered, or challenges are being offered for lessons. We're finding out what kids are doing at home when they're allowed to do what they want to do. So there are several computer science lessons, reading and math lessons in New York City that are being delivered on the local television station on PBS. We're figuring out what's entertaining for you. So that means sometimes the learning looks like a cross between Electric Company and what I used to watch when I was young, which was Teen Summit on Black entertainment television. It needs to look like what kids want to be bothered with. There should be no difference, because otherwise kids really have an opportunity to turn the computer off, or they may be online, but they're not digesting the work. We just had an event where we are using the language of computer science, data, and algorithms, but we're able to work with a group called Code Society, where they were using hip hop music, and they were using emoji, and they were using TikTok challenges for kids to present their work. I need a kid to come back to this work like they want to be there, not like the teacher has to compete with what's already going on in the household. So the other part that I think is happening besides changing mediums is just being frank about, you know what, this synchronous lesson may not work for this family at this time. There are several teachers who are surveying families, and the families say, I can't handle it. I'm working right now. Could you provide an asynchronous lesson so that we could do this work together? And then on top of that, the family may ask, you know what, my child has certain disabilities, and I was never told how I could work most effectively with the child. The teacher decides, you know what, we're going to scrap the lesson today, and I'm going to talk to the parent later about how we may do this work together. What sort of supports need to happen in the household? What sort of word wall or learning pieces do you need to have around the house? what materials and resources do you have that I can work with you, rather than even silly things like, here's a lesson, please use your printer and print out this worksheet. We really have to think about what's available for families and move forward with that.
Mm-hmm. Thank you. Yeah, no, and as a former social studies teacher, 10th, 11th, and 12th grade, and now having my 16-year-old, thank goodness that she's an independent learner. So it's been okay. Thank goodness she can be a bit of her own driver around getting her work done. But I can imagine for many families, it's the parents have become, for all intents and purposes, substitute teachers, and without having had the prep work, there wasn't a community meeting to kind of rally everybody to get them on the same page. And in particular, families that have children that have IEPs, having that full breadth of understanding of not only sort of the child's disability, but also knowing what are the types of accommodations that we can do in a home setting. So I appreciate your sort of really sort of grounding that reality as we think forward in what we sort of feasibly can expect our kids to be at in the fall, and at the same time not penalize them for the interrupted education that they may have experienced. So as we think about sort of youth that are going back to sort of are in their current home settings, LYNETTE, and you were mentioning before in terms of youth that are in detention centers, but what about youth who are starting to come back, right? And who are going to return home from detention or particular placement settings? What are the supports that are going to be necessary for that reintegration? Particularly around sort of the educational process of what they're going to need, whether it's online or in the building.
Yeah, so that transition piece is really important. It was important before this pandemic and will continue to be an urgent need. It's an area I definitely always encourage. We do need much more research about that. But one of the things that we worked on, just like even within the with the Chicago Public Schools, but like the Cook County Juvenile Detention Center. And so the school within that is the Nancy B. Jefferson School. It is a detention center. It's not it's still residential and the youth are there. They haven't yet been adjudicated delinquent, which is of course, juvenile term for sentencing, what we talk about for adults. And so what we did was actually kind of helped create sort of modules and explorations for the youth to even just kind of think about their space. And so part of it is kind of like, okay, I'm here. And so like, what are their sort of thoughts as they are sort of there in that space, but then sort of transitioning into like, what are the things that I need to be successful? So like one of those components is the mentoring piece, right? And it's just so interesting to have conversations with youth who are, in some cases, in this particular group that I'm talking about, were like 17, 18-year-olds who was just like, a mentor, I'm too old for that. And it's like, no, like even in education, like I have mentors, I have mentored folks, but I have been mentored even as an adult in my space, right? So, what I found is like, we kind of share these terminologies with youth, making the assumption falsely that what we know and experience is what everyone knows and experiences, right? And so if you ask a child like, well, yeah, like, don't you feel like you need a mentor? It's kind of like, well, what's that? If they've never experienced that, they don't even know what they should be asking for, right? And so part of this is the self-agency piece, like really helping them to know like who they are as a person, like, and what their needs are so that they can also advocate for themselves. And then the other piece that happens is there are transition specialists who help serve in that way. So kind of as they're going through this process and seeing, well, here's what school I think I would be a good fit for, right? They are then like open sort of like community meetings. Chicago Public Schools also started this restorative practices piece. And so one component of that is just having a meeting, sort of like a returning. And the transition specialist is able to share with the team, like how the youth did while they were at the juvenile detention center. The youth is able to communicate that. So in a way to kind of like bridge that piece, that's important. But I think, on the very negative side, I think it's also important that people realize, like, there are written in some school district policies, yes, for real, so that's why there's so much need for change, is that if a youth was arrested, forget found innocent, guilty, if a youth was arrested, they cannot return to the community school, right? So definitely, I know Kelly mentioned that in terms of the need to look at policies and see what needs to be changed. So that's that piece. But going back to this, like, definitely actually approaching, having the conversations and the plan in place for the youth while they are confined. There is an article that's titled Thinking Exit at Entry, right? So from the time they enter that space, how we think about what they need so that when they transition, it can be smooth. But for sure, the community supports and the resources that they received while they were confined have to be in place for them when they transition out.
Thank you so much. And thank you for reminding folks that is a, and that those are sort of policies that are not anomalies. There's a great deal of normality across a lot of the school systems, particularly school systems that I get to work with. When you look on the books, the policy books, you will see sort of this habit of sort of how we imagine youth who have had whatever type of justice involvement, that there is almost a level of dehumanization. Right, we're missing this opportunity to remind us that that they're still children, that children are still in development and are still needing, as you described early on, the points of guidance that they didn't even know that they necessarily needed, nor in some ways even were privy to the reality of what healthy guidance could actually look like for them. And so thank you so much for bringing that back to light and sort of in how we do this work. Kelly, you talked earlier a little bit about sort of the opportunities around sort of increasing sort of access to health centers for youth families in rural contexts, and I think it's sort of the language of urban health deserts, right? That are also prevalent, right? Particularly the quality side of it, right? Is, from your vantage point, how do you see administrators and education systems and community-based health providers sort of cultivating or deepening the types of linkages that they need amongst themselves, but also in terms of how they do that in relation with families, right? What's their points of reference around outreach and building partnerships?
So let me take this from the vantage point of an advocate who wants to see that all kids get the service. Because that would certainly be easier for me, but it will encompass everything and perhaps resonate with some folks who are watching. So the first thing I would do is look at the state structure as to how school health services are provided. So some states have a rather rigid, uniform way services are provided. It starts from the top down. I live in West Virginia. We have very much bottom up. So we have 55 counties, and every 55 county school system has a board of education, and they have a lot of autonomy as to how services are going to be conducted. That's good news for like our network of school-based health centers, because we have more school-based health centers per capita than any state in the country. So we know the kids in some of our rural places are going to have access to healthcare. The problem is trying to keep on top of all of those 55 county school systems to ensure that all kids have access to comprehensive healthcare, especially during this important time. And so I would check to see, who are the decision and policymakers in your state around school health services. I would look at the state plan amendment for your state to see what kind of services Medicaid is reimbursing for in your school system, because that's important, because you want to make sure you have a full continuum of services. Your school nurse may only be able to provide some services. Your school nurse may be providing a wealth of services. It's really very complicated, but important to know when you advocate for these kids that you're going to the right people about changing policy. So I would find that out. And then once you kind of get the lay of the land, I would go to parents and talk to them about challenges that they have had, especially since school stopped. So, you know, we know that we have kids with special health care needs, and they probably did not have access to a number of the support staff who was helping them during the school day now that they're at home. I have a friend who's a speech therapist, for example, and she told me that she was only in contact with about 30 to 50% of her kids while schools have been closed. That's important. You know, we need to make sure that the kids have access. You know, they have a federal right to have these services. And so what that looks like is going to take a lot of conversations and a lot of people at the table, and parents are really going to need to articulate what those needs are as policies are put into place. And so parent engagement is really important, I guess, across the board. But to ensure that, you know, they're articulating the needs, the special needs of each child. And then again, making sure that the healthcare system, not just school health staff, but the healthcare system is sitting at the table. So once you have an assessment of what the parents need, what's in that community that can be provided, and then you can kind of lay of the lands like an ecology as to what services are there, how do you get them there, and then that nimbleness that you're talking about of creating policy to ensure there's a warm handoff from point A to point B. And you want to make sure, we know that we're going to have limited resources, right? So you want to make sure that you're directing those resources towards the most meaningful services that can be provided. And sometimes, you know, healthcare is very complicated. Public education is very complicated. They're very rigid, you know, bureaucracies. And so I think it really takes that advocate and those parents to articulate those needs to ensure that as policies change, that the needs of every child are at the table.
That's wonderful, and I so agree. The need for all of what you just described, you know, rests on sort of this this beautiful intersection that needs to live across different agencies and providers, and to use your term, sort of making sure that they have sort of a warm handoff between each other, right? That there is, and that there is a healthy developmental approach that is living across all these different systems, because they're still, as we all understand, children still are children and they're still in development and have great potential. So I'm going to sort of bring us to sort of our last question before we move into our Q&A, because I'm seeing some great questions being posed by our audience. And I want to make sure we sort of allot enough time to kind of dig through some of them, because I think they're in response to some of the points that you all have made. So just to kind of wrap up at this juncture, what do you all see as some of the as sort of stakeholder innovations that are kind of developing the various communities that you all are intersecting, and the partners in your field? And what do you see as some of the potential sort of areas of impact that you're seeing or could expect to see with these sort of innovations that, again, in a space where we're realizing policy is not as rigid, in a space where it is prerequisite to be nimble, what are some of those points of innovation? Let's start with Lynette. What are some of the things that you're seeing in your space?
Well, I would say not so much to the practice side, but more on the advocacy side. This pandemic has definitely sort of increased the amount of agencies, of people who are really concerned for our youth who are incarcerated, again, specifically for those who are, you know, still just being detained, and again, for the most part, for minor offenses. So kind of looking at that differently. But in terms of the education piece, you know, part of it is, of course, making sure that youth do receive their education, just because of what you all were just talking about, Kelly, in terms of the special education piece. I just have to share this. You know, Reed and O'Cummings did a study in 2011, and they surveyed all of the incarcerated youth at the time. And at the time, we had over 2,700 juvenile facilities. If you had an IEP before you were incarcerated, how many of you are receiving those services that were outlined in your IEP now that you are confined. And only 46% of the youth who were incarcerated at that time said, yes, I'm actually receiving those services. So that is still a tremendous need. In some states, they have sort of provided or allowed for services like speech and others where normally you would not be able to have it via Zoom or another platform. But some facilities are actually, providing that for the youth. But in some states where education may be a different provider than special education within a facility, special education teachers have not provided any support. But again, because of the advocacy, there have been lawsuits that at least have ensued, and there are changes now as a result of those hearings. So I just wanted to mention that. The one piece of innovation, one that I'm really excited about is from a state that actually recently reached out that they just want to do a full redesign of their educational program, which is just extremely exciting, of course, for me. And so just even utilizing like the so the major themes from my research and work that I've been doing with folks is the importance of the relationships, expectations, resources, and accountability in these spaces. So actually building out a program with those components. And again, touching on all of the other aspects Christy mentioned earlier about our trauma and true complex trauma. And so how can we meet the needs of the youth? And just being able to like take full advantage of this time to make sure that we have the proper platform and supports are critical.
Thank you. Kelly, what are your thoughts in terms of sort of the points of innovations that are existing within your field and the partners?
Sure. So telehealth has been really elevated and in ways I never thought. So we talk about telehealth a lot in rural healthcare because we have such a lack of access, concern, lack of transportation. And when Christy was saying, doing an assessment to see what equipment kids have, on the school end, that's really important information to share on that healthcare end, because if kids have access to the necessary equipment, then they have access to telehealth, which is really important. And so we see a number of providers providing, particularly mental health care, an ability to treat families, which they didn't have before. And so I think I would love to see, Medicaid and CHIP on a national level continue to reimburse for mental health care and telehealth service. So that's a big deal. I think that we see a breakdown in, the nimbleness of policy. So particularly when we're looking at the healthcare system, you see kind of suspended the certificates of need. And Eddie, I know you said that you worked with community schools before. One of the things that really lags before you see implementation of co-located services in schools is the whole process of a change of scope and, making sure that all these processes are completed. Now is a really good time while some of these processes are suspended is to co-locate some services in schools. And so I think that there'll be some innovation there. And then I think that we're seeing more cross-sector collaboration in discussing some of the policy issues that hold us back from utilization of shared data systems and conversations that we never really had before, or if we did have them, we just thought that there was no way that any of these policy changes could be made. It was too rigid, but now we're really seeing an ability for people to adapt in ways that we didn't think before, and I think that we'll see a lot more systems adapting to the needs of community. That's at least what I'm seeing, and I'm hoping, I saw a little bit of this years ago when, H1N1 was around, and then all the kids got inoculated, and then they stopped. But this is really a moment for us to ensure that those cross collaborations continue.
especially knowing that there's a longer sort of time frame for this, right? To know, so it's that innovation is not for a hot minute, but we're looking at for a lengthier time, that in some ways, hopefully this habit of innovation that we do in these spaces become normality, right? And we reimagine or imagine the way in which we operated before was part of our history, and we've now sort of punctuated into a new level of how we're imagining our innovation. Christy, from your vantage point, again, what are you you're seeing in terms of the innovations, in terms of partnerships around ensuring sort of the development around computer science and literacy skills among kids?
There are several pieces. It seems as if in some instances, private folks have stepped up to help us with equipment, some instances, but there's no reason why private industry can't help solve this problem. If we had to wait to have the funding to give every child a piece of equipment they need, that might not happen. But if you are doing business within a state, it really should be a requirement that even if it's your used equipment, it should go to children. There's no excuse at all. This is a problem that needs to be solved immediately. And I'm hoping that we can follow companies who have given their equipment to schools. But I still want to go back to the point about community schools, because every single one of you have mentioned it. It makes it easier for us to come in and talk about computer science when the school is a place where as many needs can be met for the child and for the parent. We're even willing to come in and talk about how parents can have jobs within the computer science field. But the pandemic is proving that all schools can be community schools. The amount of meals that New York City has served alone is ridiculous. This could happen possibly all the time. Does it mean that we may need to defund certain things like policing and then put that funding into community schools? Perhaps. But the thing that's also making me very happy is seeing how many folks, not just in computer science, but with other subjects, we talked about have used different mediums to work with children, to make education entertaining so that they won't turn it off. But what I'm also finding is that there's a focus on anti-racist education. Of course, it has come up because of George Floyd, but folks are realizing that unless we allow teachers the time to talk about how race intersects with what happens every day in the classroom, we are not going to make much progress. There was a time where folks were fighting us. We were talking about computer science and race, and people couldn't understand why the two were connected. We would like to talk about data and algorithms and how they can be used as weapons of oppression, and no one wanted to hear it. Now it's time. We are beginning to talk about the FBI and counterintelligence and how data and algorithms are being used to surveil protesters. So now we're saying, hey, there is a need for computer science. That piece of pedagogy, that anti-racist education, if we can actually allow educators to have time to do the internal work, to slow down and figure out what they're doing in the classroom that may cause a problem, or what they're omitting in the classroom, what they're not prioritizing, is incredibly helpful. I think there's no turning back now that we've started this work.
Mm-hmm. And thank you so much for bringing that up. You're right. There is the capacity to have a critical lens that allows for being able to see how our different demographic identities that we carry, how they get fed within the ways in which we operationalize our work, is a necessary skill and toolkit to be able to develop. And it's at times I sit on various advisory groups, and one that I sat on of a city government that I will not mention. They were talking about using predictive analytics to understand, to look backwards around in terms of youth who've had who've been engaged with the juvenile justice system. And what was disturbing was the conversation, the data points that were being used to do the predictive were all risk factors. And I posed a question. I said, so can we add in there the measures regarding the amount of protective factors that are also at play alongside these risk conditions, so that we're not just treating it as risk is something that is present and kids are enjoying swimming in the risk, but also it's a matter of the tension that it exists with the amount of protective factors surrounding them, meaning the amount of, good health care of services that are around, the provisions of mentorship that are available. And the response that I got, which for me was very telling, was we don't study protective factors. We're only studying risk factors, right? And so at that juncture, that said, okay, so why do we even need to create this algorithm? we already know the answer. Like, why are we going through this exercise? But I think part of it is there is an absence of sort of recognizing of what the unhealthiness is involved in when we're only looking at risk factors, and we've already positioned that a lot of these risk factors are occurring as a result of historical and systemic nature of oppression, right? But that's a skill that has to be developed, and it's not enough to just read a book, right? You actually have to do the concerted effort of that development of skills work around that. So I want to bring us to sort of our last question before we open up our Q&A, and really sort of talk about, from your various vantage points, what are some of those, critical sort of questions or implications of all of this work that we're doing now? What are the implications or questions we should be asking of research moving forward now? Because we are definitely moving into a very different space that I'm a half glass full perspective. I see it's an opportunity for us to think and behave differently. And, but it requires that we kind of set the tone of, like, what are some of those great questions that we should be having in front of us and pushing ourselves into, as if you think about Bloom's taxonomy, really asking sort of those higher analytical types of questions, those synthesis levels of ideas that are important for our work. So I'd like to hear, so Lynette, if you can, kick us off and, share sort of what's that great stuff we should be thinking about now?
Sure. I mean, I think it definitely has come out within the discussion that we've had so far. Within confined spaces, there is this SNS, safety and security. And if in fact there is a belief that something will get in the way of it, even if it is the best educational tool, program for youth, the facility will always use safety and security as, well, we can't do that because it would impact the safety and security. So I think for sure, it's just how do we establish like appropriate structures and incorporate the much needed technological tools within these spaces for our incarcerated youth. That has to be a question. Again, this is what Christy shared, just even in terms of what partnerships need to be had. But again, going back to the policy piece that KELLI mentioned earlier, like there are some states written in their policy, they cannot have internet within the facilities or computers in the classrooms. Like, we're in 2020, like how bizarre is that? And again, the gap continues to widen because of our, again, disproportionate number of youth who are children of color, children of poverty, special needs, LGBTQI, it's just, this is what we're facing. So for sure, the technology tools. I think the second thing, which is what I mentioned earlier in terms of the math piece, how do we, provide a high quality education when across the board, it really is almost like the one room schoolhouse where it's multi-age, multi-level youth in a room, right? You may have a general educator. In some very few places, you might have a general educator partnered up with a special educator. Okay, but like how do we do this with 12, 19 youth in a classroom? And then I would just say the third one that I have is just to what you were just saying, Eddie, in terms of like, we can't be like reactionary. We can't just talk about only the risk and not about the prevention, like not about what foundation is needed to like help make a child whole, like Maslow's hierarchy, right? Like decade-old work that is still very relevant today. And so truly looking at the needs of our youth and, you know, yes, increasing the diversion programs is important, but really seeing what the needs are when, you know, from the time, of course, yes, they are even conceived and like what care they're receiving, but like once they even enter in our communities and our schools is truly important. And so I would say like those would be the three that I you know, would definitely want us to continue to focus on.
Thank you so much. That's spot on. Kelly, what are your thoughts around sort of what should we be asking?
So my big question is, we need to study the negative consequences of isolating children from their peers and whether the isolation outweighs the concern of children contracting the virus. I think that we are erring on the side of caution. You know, I talk to a lot of parents and guardians who are saying, you know, until there's a vaccine, if I can, you know, educate my child at home, that's what I'm going to do. But there are real consequences to that, and we need to be looking at that. Secondly, we really need to look at how we collect and disseminate research. So it is a really long process until it's peer reviewed and it comes out in a finished product. I think that time is of the essence and research is critical. And so there needs to be more communication between systems, advocates, and researchers as to what they're seeing and getting that information out there. And then finally, for someone like me, I'm going to really pay attention to Medicaid because all of our states are seeing budgets, you know, budget tightening, and Medicaid is usually the first thing to get cut. And Medicaid provides so many services for our kids. 39% of those who are insured by Medicaid are kids. And most of our school services are paid for by Medicaid. And if we're not diligent, once they start whittling away at that budget, we may lose ground rather than gain ground. So I think that's something that we really will need to keep an eye on as well.
Thank you. Christy, what are you seeing as some of these sort of, as the next set of questions and both in research and practice that we should be thinking about and the implications around that?
I'm wondering just how quickly we can elevate the teaching profession and honestly talk about the power of someone who is in the room with kids for 6 hours a day or communicating with them virtually. But I think what's happening is teacher education just hasn't had the time to honestly talk about how teachers are unwittingly often used as the oppressor in the American system. Teachers need time for introspection. And with all this anti-racist education work, I'm really afraid I can see what's happening already is this performative allyship. We're going to check the box and say that we did the work, and it's going to be worse than ever. We keep making the same mistakes over and over again. And I'm hoping that we might figure out a way. This person has a lot of power. This person is incredibly valuable. How can we value him or her and allow them the time to do the study that they need before they have to come back to the classroom? We figured out that, okay, these folks are working more now than they had ever done before. I think we can leave them alone for the summer or for some longer period of time to have some introspection. And what's also happening is these folks are moving at lightning speed. Teachers are going to computer science teachers. They're putting their own children in the car, driving to a student's home to figure out some sort of tech issue, or using their personal hotspot to fix a tech issue. Or they may be delivering pizzas or giving families toilet paper or tissue or paper towels, or telling them about how their school is now a community school and is offering different services. This is just not sustainable. COVID is going to continue for quite some time. I'm wondering, how might we provide assistance to these educators? Is it making a larger presence for the National Service Corps? Is it, again, defunding some of this policing and using some of the billions of dollars, or perhaps even the National Guard, to help these teachers who are doing daily service calls? And again, I'm wondering about the internet, high-speed internet and equipment. How might we provide this to every American? This is the United States. We need to give our people a chance to get in the game of communicating effectively and powerfully.
Nice. Yes, thank you. Thank you for all three of you for really sort of providing such a sort of diverse point of reference in terms of how we are moving forward in this environment. We are, and also not only sort of in terms of COVID, but I really appreciate you all sort of laying in sort of the significance of having this, again, this punctuated moment in which we have yet another sort of dominoes of events that have really punctuated, again, the nature of institutionalized racism that exists across various systems. One of particular, obviously, attention is policing, but I think in the manner that, you know, how do schools also sort of represent and sort of embody some of those? How do juvenile justice systems also represent and embody those? But what's going to be the vaccine that we're going to need for all this? And I really appreciate you all sort of really sort of laying out the potential of, you know, what that vaccine could look like for all these various systems, for really sort of rooting out sort of that pervasive issue that, you know, we've cultivated for over 400 years and have only had 60 years of trying to root it out, but yet have not had systematic ways in which to do it, you know, and it ain't enough to read a couple of books, right? So with that being said, I'm going to sort of post some Q&A questions that I think our participants have put on the Q&A chat. So I'm going to go through, I'm going to sort of pose one. I think some of them are directed to some of you. And so I want to start first with a person, James Acker, and I think this one is directed to Christy. Could you comment on the content of educational curricula being provided to youth? And in particular, whether in light of longstanding and again, emerging issues of justice, whether adequate attention is given to civic education, discussion of constitutional values and rights, and related matters? It's a great question.
It's an amazing question, and I wish I had that answer. So for computer science, that's where we begin and end, right? It's our opportunity to connect with the social studies teacher to talk about how these movements can possibly work together. But every single state is different, and you also know that every classroom is different in terms of what we're prioritizing now. I think the most difficult piece is remembering that teachers are having to teach to a test, even though we may not make that headline. It's primarily reading and math. Social studies may be on the back burner along with science.
Exactly. And that's in some ways a bit shocking, right, to imagine that. Another question, I think this one may be more directed to Lynette. A lot of youth have been released from facilities over the past 2 months. Have you seen adequate re-entry planning, especially reconnecting youth to their schools? My fear has been that youth were sort of thrown back to their homes or into community at a time when homes and communities are very stressed. That strikes me as a recipe for disaster.
Yeah, so thank you very much for that question. As you can imagine, just even with what we're experiencing with, of course, just the shutdown, right, across many states and in terms of work and school. So for when these youth do transition out, even if there was a plan to, you know, find employment or to re-enroll with school, prior to this, our school districts were not fully equipped to do right by this population. And so while there is not a specific example that I'm able to cite for you on this, you can only imagine just how much sort of more difficult, how much this situation has sort of heightened this grave situation for the transition process, because where are they transitioning to? You know, part of this is, well, for the most part, even for youth being released, once they transition out, you know, some may have to even find a place to live, you know, that. So one is like, is that even the right place for them? And again, just going back to what Christy shared earlier about this technology component within homes, like, that is not a guarantee. And so I would just imagine that many of them have, I mean, yes, probably happy to be home and be free in that sense, but that there is a huge gap and disconnect between the education piece and even sort of the job piece.
Definitely. That's amazing. Thank you so much. I'm gonna, another one here. Of course, as folks are typing, the chat keeps moving up, and I lose my place in terms of the question that somebody posed. So there was a mention several times, or several of you have mentioned sort of the recognition that there are forms of trauma that are happening for our kids and their families. And I think Christy, you had talked about it sort of as a double trauma that's transpiring. And I know, Kelly, you also alluded to sort of the recognition that there is, you know, the what happens when there's disruptions around the types of healthcare that kiddos and their families need, and what that sort of, and alongside the economic sort of reality that's also happening for families, that is also sort of playing a role there, because we know that some of the manner in which health happens in some communities, and I would imagine in rural communities, there's decision making that folks are making that are predicated on do I go get this versus I need to pay for this, right? What do you all see as understanding as sort of the layering effect of some of these sort of traumatic sets of experiences, not only currently, but also as we look in the future, moving forward, you know, what may be some ways in which our various systems need to consider these different facets of trauma? So Kelly or Christy, whoever wants to chime in first.
I think part of it may be allowing educators, allowing administrators, allowing full systems time to work with developmental psychologists to really pick apart what social emotional learning means, especially when you combine it with culturally relevant ed. So especially what I'm watching is teachers saying, well, I don't know if the child is apathetic. I don't know if it's a lack of focus. How could you not be apathetic or not have lack of focus in the midst of all that's happening? We just haven't given a priority to social emotional learning. There will be a generational trauma from what's happening right now. All of these different events. And if we don't take the time to slow down and say to teachers, you know what? You can stop production. You can halt it. This may be about learning partnerships. This may be about establishing yourself as a trusted mentor and arming teachers with, even if it's simple things of journaling and storytelling and breathing and mindfulness exercises. But what's happening is that has nothing to do with the test. So perhaps that's not being prioritized. But we have to be honest about what happens when these sort of worldly events are coming together and we're not making time for it because we're too worried about production.
I completely agree with you on a number of things. I think that we have to really take a look at our healthcare network of mental health providers. So we have known that we've had serious problems with a lack of recruiting and retaining providers, particularly in rural settings, but all across the country. And this has been going on for a number of years. And what has happened from my point of view is that when you don't have the providers, people start teaching the teachers. How do you identify ACEs? How do you treat trauma? And then we just put something else on the teacher's plate rather than, again, doing that warm handoff of just teaching teachers how to identify it, how to, you know, help what is the word I'm looking for? To address stress, and then do that warm handoff into care. And I think that it really takes that assessment of those systems to see where those gaps are. But there are certainly incentives that we need to be looking at immediately to get providers into areas to ensure that kids have access to their needs now, rather than to hold off until they become adults. And then we start seeing all sorts of problems.
I just also just want to jump in and add just something to that. It clicked, as Christy mentioned, in terms of like social emotional learning. Just to mention, Road to Success Academies, based in LA in California, their curriculum is, they do use a project-based learning approach, but SEL is interwoven throughout. So just wanted to kind of mention that. And then the other piece, in a way that an organization has helped sort of ease, and I would say just sort of provide comfort to many of our incarcerated youth during this time, is the Center for Educational Excellence in Alternative Settings, long name, but CEEAS.org, have a pen pal experience. And so people from across the United States have been writing letters to incarcerated youth during this time, and the youth have then written letters to their pal, and that has also just been a way to just demonstrate love and care. And it's just been remarkable to even just hear some of the comments from the youth during this time. So I just wanted to mention those.
Thank you all for sort of really chiming in on this. I mean, you're right. There is an element of, so what are the practices that are out there that lend themselves for healthy social emotional work that provides kids an opportunity, particularly in this moment, to not only as they think about their own habit of self-reflection in being isolated from their peers, right? Because kids, part of their social emotional development is predicated on having interactions with their own peers, and sort of having that reduced, and as well as that the adults having that being reduced, really sort of puts kids in a space of social emotional development, particularly the self-reflection that requires them to have some tools to be able to build that up. But also the dynamics around what's happening around the protests that are happening, really speaks to that social awareness set of social emotional skills that kids are needing to develop. And in the absence of not having had contact with their peers, not having sufficient contact with the adults surrounding them, we're having our kiddos who are on the street, who are protesting because they're in needing to really sort of practice and demonstrate sort of these points of social awareness, but needing that guidance. So I so appreciate you all highlighting that. And also Kelly's point around bringing up ACEs, right? Sort of the recognition that, it's not only sort of that it's the kids who we're understanding in terms of what are the different facets of adverse childhood experiences that they're having, but also the adults that are working with them, right? One of the things that that Robert Anda and Sandy Bloom have said many times is, what happens when you have hurt people working with hurt kids, right? Like there's sort of this constant sort of iterative process that keeps happening. And what are the mechanisms that we're going to need to put in place to disrupt that mechanism between hurt adults working with hurt kids, particularly given the types of hurt that they're contending with right now? I'm going to ask a question, and any of you can answer, is a question raised by Brian Rainey. For kids with special needs, are there best practices that you all are aware of and what you all have been engaging in that in your specific jurisdictions for access to much needed support?
So I'm assuming we're talking about in this moment, access.
Yes. Yeah.
So what I am hearing and seeing is that there has been really kind of a push of the pause button. And so, you know, people are just waiting until there's an ability for the kids to get back in school, for kids to have access to the needed equipment and services. So there really needs to be a large push on a national to local level to ensure that, you know, now that we know that this isn't going away anytime soon, how do we ensure that kids have access to the services that they did when, you know, they were still going to school every day? And there needs to be conversations about that. We need to have conversations about how schools maintain compliance with IDEA, and how you know, kids are going to have to transition back to the normality of going to school. So we know a number of kids are disrupted, and I'm sure some parents and guardians went through a rough process of kids reacclimating themselves to a new schedule, and now they're going to go back. And so it's really going to be a community needs assessment, and then see what you have in the community for the community response. And then they should really create a list of things that they need from their school system and do it quickly while the school system is creating those policies, because school systems have kind of this way of creating policy internally and then putting it out there for 30 days, and you don't hear about it for 2 weeks, and then people really scramble to respond. So right now, you know, getting that list together and going to your school with, here's what we're going to need to, if we're going to be sustained longer, and get that in there while they're making decisions.
I think part of this, definitely we need to also just have a special education conversation and what that means. What does an IEP mean? Quite frankly, this is probably not the right panel or forum to like bring this up. So I just need to put that out there, right? So one example is of a 19-year-old who was incarcerated. It was shown in his IEP that he was reading at a first grade level, and the strategies for him to work on, or the teacher to work on with him, was inferencing, sequencing, and is like, no, you actually need like those high frequency words and digraphs and blends, right? So part of that is like, do we even know how to meet the needs of our youth? And I know we live in a time of labels, like this is what we do as a nation, but we have to get away from labels and really see every child as a human being, being able to see them as an individual. Yes, you know, I understand if whatever it is, whether it's autism or what have you, I in a way kind of understand, but I really just believe if we see that individual and are truly concerned about what they need, then it's a matter of, okay, how do we provide the right access, the right training and support? Again, as was mentioned earlier, teachers, even special educators need additional training and really to understand, because we have diverse learners. Every human being is unique. So even in our best special education format, I just pose to everyone, I'm just going to leave it at this: what does the data show? How are our special education programs providing all the youth that it is intended to serve with a quality education? And this is no dig on any individual, but we have to look at things very differently, and especially during these times, to make sure that our children really do receive the support that they need to be successful.
And just picking up on what Lynette was saying, it's very difficult, because what I'm finding is that there are families that can afford a neurologist. You take the child to the neurologist, and the neurologist will work with the child, and the child is able to go back to the classroom and advocate for themselves. You know what? My preferred learning style, I'm a visual learner. If you could please write that out for me. My preferred learning style, you know what? It may be visual, and I can't work with someone who is. We need to be able to provide some sort of independence for families who don't have access to that neurologist. So what's happening is we need to have folks come in and talk with teachers and children about what works for you. What do you need, especially to work appropriately independently? If I had the money, I could go to a neurologist, and the neurologist would tell me what I need right next to my screen while we're going through remote learning to make this work. We need to provide that to every family, even if you can't afford a visit to a neurologist. And I think the other very difficult piece is you've asked teacher education and teachers to do it all. What happens is teachers need to understand social emotional learning, universal design for learning, project-based learning. Now it's racial literacy plus activism plus awareness. We have to do all this plus for computer science teachers to get them to understand culturally responsive and sustaining education. But we're saying it's time for, you know what? Humanizing pedagogy means putting all of these things together and then allowing teachers to work it out in the classroom, but also providing experts in each of those areas to come into the classroom. The data on how many guidance counselors or social workers are available in a school is ridiculously frightening. And now that we're going through this double trauma, I'm even afraid to look at what those numbers will look like.
Mm-hmm. And you're right, to your point, Christy, I also serve as I'm a school board member here where I live in Yonkers, New York. And, we just passed our budget last week. And it is, we did our best knowing what our shortfalls were and try to have an equity lens to how we to make sure that we know that we have social emotional needs that are going to be presenting among our youth, that we, prioritize certain parts of adding dollars in, but also knowing that there were dollars being subtracted in other areas. And that is so devastating to kind of have to make those types of decisions, knowing that it's not adding to our perspective of ensuring that that our children are having a whole social, emotional, moral, cognitive, and physical set of experiences that they're getting developed during the course of schooling, and in relation with the community centers that are also going to be taxed in terms of having limited spaces and opportunities to provide supports, and the types of community health centers that are going to be taxed in a very different way. That leads to sort of moments in which we're going to see kids are going to have sort of a lot more unstructured time, right? And the concern is what happens, what do kids are privy to in those unstructured times that if without those levels of protective factors, we run the risk of our kiddos sort of beginning to engage in the justice system in ways that we don't want them to, right? Mainly because we've had to make these hard decisions now that is really sort of devastating. So one of the last set of questions I want to pose is, there have been various questions around, the financial impact on education resources in terms of COVID. But I think we can extend it also to not only sort of education resources, but also in terms of healthcare resources, and also juvenile justice sort of resources. Where do you all see as some of those, so if you all can reflect on sort of the financial impact of this current sort of COVID condition?
Silence. I mean, what could we say here?
If only we could win the lottery, right?
You know what's happening.
Mm-hmm.
We do not have the billions of dollars spent on policing for education. And it is educators at schools who are spending the most time with children. To be frank, you know where dollars are going to end up. It will be educators who are using their personal money to provide things for families and students. There are educators who spend as much as $4,000 a year, either soliciting private companies or working with their friends or out of their own pocketbook to make up the differences of what happens in the classroom. it may be even worse this time. That teacher that I mentioned to you, they make home visits, again, coming out of their personal pocketbook. And it's not such an unusual situation. I call that teacher Carla, but there are lots of Carlas that I hear from every day doing the same thing. And believe it or not, their relationships are going down the tube because they spend so much money where the state or the city or whatever their local government hasn't provided for them.
I think what's been interesting that I've seen, in these spaces is, as I mentioned earlier, the numbers of youth who are incarcerated, again, because of a lot of advocacy work with diversion programs, et cetera, the numbers of youth have decreased. But what's interesting and kind of, I guess, connected to what Christy shared is in terms of the staff on the program side, you look at sort of the numbers in terms of budgets, and it's been the same on the enforcement, rapid response team, youth care workers, juvenile justice, that's kind of been the same. On the education side, I mean, pre-COVID, I was not really advocating for more funds just because I've been in facilities where it's just a waste. And again, part of this is perhaps just even not knowing what we do with this. When you look at even some school districts who may have additional funding, but okay, it looks like a higher per pupil expenditure, and yet how come we're not getting this, right? So again, this goes back to the beliefs and all of that, as we talked about earlier, of who we are serving or what we should be doing to serve and do the right by the children in which we're given charge to serve. But in some places, they purchased the Promethean boards, the smart boards. There were plenty of resources, but they had remained in boxes for years. There was this, well, I wrote up the ticket, but they still haven't come yet, right? So for me to see that, I personally, I'm not advocating, and oh my goodness, people are going to be like, what, Lynette, we need more funds. Of course, you can live a better life, right? So to speak, right? You can have things if you have money. So let me just say that it is a beautiful thing to have funds, but the accountability piece must also equal the amount of money that is in place. And all I know is pre-COVID, plenty of money was being wasted. And I think part of it is well, we have this budget, we have to spend, 40% on the materials and 60% on human capital. So as long as we meet that, we're fine. No, we have to look at it a different way. And again, starting with the learner in mind, what are the needs of the youth in which we are serving, and what is the best plan of action for them? Yes, if it is done in that way and it is determined that additional funding is needed, my goodness, if we really care about our children and our society as a whole, we have to provide that funding for them.
Mm-hmm.
I'm going to agree with Lynette that there is some systemic dysfunction, that sometimes you get money thrown at the problem, often by state legislators, at least in my experience, and then the system's not ready to disperse the money in a strategic way, and then a couple years later they come back and they say, well, we gave us the money, where are the results? And so everybody wasn't prepared. So I think that getting a plan together, my biggest concern is that we're going to have kids who are going to be fine at home, and mom and dad's going to make sure they have the equipment and everything that they need. And then the kids that we have in the school are going to have real specific needs that we need to be focused on. And yet we'll see some school systems who put more money towards the kids who are learning at home, and it's going to be to the detriment of the kids who are remaining in the school.
Mm-hmm. Thank you. Christy.
I have to say, to Kelly's point, what I'm afraid of is going into the school year is seeing two totally different cities for folks who are able to stay at home and folks who do have to go into the classroom. I'm frightened by it, and I don't have an answer. Mm-hmm. But to go back to Lynette's point about that equipment sitting there, we all know it, right? Especially when it comes to tech equipment. But sometimes money has to be, time is ridiculously valuable. So if money was spent to bring in other folks who could do appropriate things with children while teachers were learning how to use the equipment, I bet you would never see anything in the box. But teachers are working 16 hours a day. They just do not have time to learn something new unless schools get to the point of using that money not on things, but investing in their people to have the proper training, we won't see changes.
This has been amazing conversation that we are having here on this, again, not only sort of having this conversation, but also the unique format in which we're having this conversation, right? So in such a way that is, tapping into the resources of the sort of the, of how we're existing, but also, I don't know about you all, and I know there was a question in the chat that somebody posed around sort of the real effects of, of video conferencing fatigue, right? That I think I don't know about you all, but I've been on a roller coaster of how I feel about it. There are some good days, and there are some days where I'm just like, I am done with having this amount of of engagement that's solely bound to this virtual space. But I have to really commend you all for being so very focused and lasered in terms of sort of providing our audience sort of ways in which they can think about this work, the intersections of the COVID reality, the intersections around the highlighting of our systemic oppressions that are existing within our society, and with the education system, with our healthcare needs and centers of work, and also our detention and juvenile facilities that are, all of it are surrounding the same set of individuals, right, that we're all committed to. I want to thank everyone who's been participating and sitting in on this conversation. We hope that you all have gained a great deal of insight. I know I have, in terms of listening to sort of this great panel. I've loved watching our artists in residence sort of really capturing sort of what I call sort of the golden nuggets of stuff that folks have been tossing out there, and moments in which folks drop the mic. It's really immense, and I really appreciate you all for really lending your expertise. I'm going to turn it over to Giza to kind of sort of wrap us up.
All right, thank you, Eddie, and thanks to all the panelists. This has been an enthralling discussion, at least from my perspective. I've learned so much from all of you. Eddie, you are a skillful moderator. I know how hard it is to bring all these voices together, and you did so with such elegance. So thank you. Thank you for your time doing this and for your expertise. Thanks also for reminding us, or calling our attention to, this notion of hurt adults working with hurt kids. The levels of compounding stress that we're facing right now, right? Not only with the pandemic, the economic crisis and the inevitable cuts and job losses impending, as well as, of course, the recent events in Minnesota and the reactions nation and worldwide. So thanks for drawing our attention to that. Lynette, you bring to all of us, as Eddie said, a very unique and important perspective. I appreciate the need to prioritize education behind bars, as well as address meaningfully the digital divide that permeates this. I'd like to add that although we've emphasized children and teens here, we're very much interested in how all of this impacts emerging adults. And as you know, emerging adults comprise a huge portion of folks behind bars in prison setting as well, where education is also of importance. So thanks, Lynette, for that very much. Kelly, I am a researcher by training, so I really appreciated the point that you made about collecting and disseminating research. Stop working in silos, if I may paraphrase what you said, and perhaps drawing on your experience with media. One thing that I would add is this idea of translational dissemination of findings, right? There have been so many cool dashboards and other resources out there tracking data with specific to COVID prevalence and so on, and we can learn so much from that field. and really make information palatable, right? As much as we want to disseminate it in peer-reviewed articles and this and that, it doesn't reach the right people. So thanks for that. Christy, yes, teachers need time for introspection. Thank you for reminding us of that. I think we all do. I have 2 children at home that are 8 years apart, and it's been a struggle, but I do take inspiration from their teachers and their commitment to them and their unique needs in the developmental spectrum. So thanks to all of you. Thanks to folks who stuck with us until now and have been with us throughout the week. This has been amazing. I invite you again to join us tomorrow, if you can, this afternoon, if you're not Zoom fatigued. And we're keeping the conversation on this thing called Padlet, which is a virtual bulletin board where you can post questions and comments and share resources. So thanks to all, and I hope to see you later and tomorrow.